You go to the fertility expert and then you are told that you need to get the fallopian tube test done, and you wonder what is this test all about, how important is this? Now you need to know this fact that infertility because of tube problem will contribute around 25 to 30% of all the infertility cases. So hence it is very important aspect of fertility evaluation. So today I am going to dive into different types of fallopian tube tests. Now what are fallopian tubes? They are very important structures that connects the uterus and the ovaries, and the main role is that it allows the sperm to swim through the passage and reach the other end of the tube where egg is waiting to get fertilized, and this fertilized egg is again going to come back to the uterus for implantation. So did you know that if the tubes are damaged or blocked, then this is going to significantly impact the conception? So understanding the health of your fallopian tube is of utmost importance, and there are different types of tests available that will help you evaluate its health. So let's explore the different types of fallopian tube tests and how do they work, what are the advantages, what are the disadvantages, and when and how these tests can be performed in your menstrual cycle. Greetings from Samruddh Fertility and Urology Center. Hello everyone, I am Dr. Indu this end and I am your fertility guide. So there are many different types of tests, but I'll be sharing only three primary and commonly done tests that are used to check the patency and the openness of the fallopian tubes. Now what are these three tests? Number 1 is the Hysterosalpingography, number 2 is the Sonohysterography, number 3 is the Laparoscopy. Now each of these tests has its unique approach and purpose. Let's break them down one by one. Coming to the first modality of tubal evaluation, that is the Hysterosalpingography, also commonly known as HSG, and a very commonly done test. Now it's a special X-ray test that has to be performed within 10th day of the menstrual cycle, and remember that the bleeding should have stopped. Now this test can be done by either a radiologist or a gynecologist. Now during the procedure, what is done is that the doctor is going to inject the dye through the cervix into the uterus and then the fallopian tubes. Now as the dye is passing through, the X-ray images are taken and it is seen if the dye moves freely through the tube or if there is any blockage. Now it's a bit uncomfortable, but generally it's a quick test and it also provides valuable information about the structure of the uterus and the tube from the inside. Now what are the advantages? Number 1, it's a simple procedure. Number 2, it doesn't need more than 5 minutes to do it. Number 3, one gets an X-ray film as a document that can be assessed by any other expert if required in future. What are the disadvantages? Number 1 is one will get minimum X-ray exposure, and so only it is told that the test has to be done within 10th day of the menstrual cycle. Number 2 is that during the procedure, if the patient is having some discomfort, some pain, then the patient may move and this may cause blurring of the X-ray films, or the fallopian tube may not fill properly at all because of the spasm, and this will give a falsely blocked tube on a report, but actually it may not be blocked. Number 3 is the reaction to the dye that can happen. Now this reaction to the dye is an extremely rare possibility, and I have not seen this in so many years of my practice. Coming to the second modality of tubal evaluation, it is sonohysterography. Now sonohysterography is also known as saline infusion sonography. This test uses ultrasound technology. A saline solution is injected into the uterus through a thin tube, and then the ultrasound probe is used to capture the images. The saline actually helps to create a clear picture of the uterine cavity and the fallopian tube. Now this test is less invasive than HSG and it doesn't involve any radiation, so it makes a preferred choice for some women. Coming to the advantages, number 1 is that this can be done on any day of the menstrual cycle. Number 2, it is less invasive. Number 3, there is no radiation exposure like it happens in HSG. Number 4, the procedure can also diagnose the abnormality if it is there inside the uterine cavity, such as small growth called as polyps. What is the disadvantage of this test? Unlike HSG, this is not going to give you the images or images that is going to show the tubal outline. Coming to the third modality of tubal evaluation, this is the laparoscopic test, which is a surgical procedure, and this is considered only when the other tests are showing some problem. Now during laparoscopy, a small incision is made in the abdomen, camera is inserted to view the abdominal structures. Now one can check if the ovaries, uterus, fallopian tube and its relationship to each other, is it intact or is it disturbed, and also relationship with other abdominal structures. This also can be assessed when we do the laparoscopy. Now this method allows a detailed examination, enables a surgeon to tackle any issues such as if there is any simple scarring around the tube, this can be removed. If there is any blockage of the tube that is simple in nature, that can be dealt with right away then and there. Now any other associated abnormality, if it is there, then that can also be tackled to enhance the fertility. So what are the advantages of laparoscopy? It's actually a highly accurate and a very effective way in diagnosing and treating the fertility issues. So only it is said that the laparoscopy is the gold standard for tubal evaluation. When it comes to disadvantages, it is more invasive, it requires anesthesia and you need to be admitted in the hospital. These were the three different types of commonly done tests for tubal evaluation. Now each of these tests has its unique pros and cons, and your fertility expert is going to recommend the best according to the specific situation that you might be in. Now it is essential that you have a thorough discussion with your doctor and understand which test is right and what to expect from the procedure or from that respective evaluation. So this was the quick overview of the main tests that are used to check the fallopian tube patency. If you are on a fertility journey, then understanding these tests are actually important. It will empower you to make an informed decision about your health. Now, if you have undergone any of these tests or if you are considering any of these tests, then share your experience or your questions in the comment section that is given below. Don't forget to check on my other videos on the fertility topic, and if you found this video helpful, useful, then share it with someone who might be benefited. Subscribe to my channel for more such content and hit the notification bell so that you don't miss any updates. Thank you for watching and I'll see you soon in the next video.